Hello, everyone, and welcome to News and Views for October the 31st, 2024. Yes, we are here on Halloween, enjoying all of the children coming by for treats today and looking forward to more tonight. If you are around town tonight, bundle up. It's getting a bit into fall weather, and I'm hoping we'll see you all outdoors. 3 items on our show today. First of all, we have the update on the new Neepawa Health Center, which happened here last week. A big Q&A happened with the Health Authority. It is a short version of it here on the show today. We do have the full hour-long version elsewhere in our schedule if you want all the juicy details. We also had a bit of a trip around town. John Drinkwater got in his car and checked out all of the Halloween decorations around town. So you can get a glimpse of that here on the show today. And I'm sure if you're out and about, you will see more of those tonight. And finally, we have hockey highlights. This is from the Titans versus Selkirk game from October the 29th. I unfortunately wasn't there. Heard it was a great game. You will enjoy this. And that is our show for today. So if you have anything that's going on coming up or that you would like us to know about, please do get in touch. We always appreciate it. We try to get around to everything we can. We just don't always know what is out there. We really count on our viewers and the public to let us know what is happening around town and around the whole area. So you can get in touch with us, NACTV at wcgwave.ca and at 204-476-2639. Thanks and enjoy the show.
So we'll start with a couple slides about the site and some of the current photos of where construction's at. And then we'll progress on from that. So I presume most people have seen the large building off of the highway there. The highway would be just down below the floor level on the ground here, because there will be some space before the actual property of the hospital itself, which aligns up with I believe is it Broadway that lines up into town. But is not fully connected through at this point. As we come in, coming from High Life, there is the connecting road that comes across. At this point, it extends to about the end of our site, and in the future, there is likely to be more connection across, but that's up to the town and as services and the rest of the area gets developed. The main public access into the site will be over here on the east side of the site, and it comes in and splits to having both an entrance right up to the front entry of the building here that has the south facing. So we have some parking here. There's also a direct line that comes around to the emergency department entrance, and so there's some public parking there and drop-off areas that are suited for that. As well as the ambulance garage, which is on the side of the emergency department, and allows them to have direct access into there. A couple other spaces, and then I guess we have secondary access in, which allows for service vehicles, which will be coming to the loading dock area at the back. We have the staff parking over on this side. A couple other spaces we have out here. There is a decent-sized building that has the emergency generators for the building in it. And so they're in a separate space. It's slightly disconnected from the building for different reasons with code and the rest of that. We also have a small maintenance garage, and then we have a helipad that's over adjacent to the emergency department so that we can have access into there. One of the other interesting things in here, we have this large pad over on this side. This building is going to be fully electric, which is a pretty significant item for a building this size for healthcare in Manitoba to have. I mean, some of Hydro's power has a bit of carbon in it, but for the most part, operating-wise, it'll be a carbon-free building, which is pretty significant and pretty special. But to do that, to get that amount of power from Hydro, we're actually taking a high voltage line off of the power that runs down the east side of the site, and we'll have a substation, which is essentially a number of poles that take power off of there and then bring it down to the power level that will be used for the building. And so from there, underground, the services will run and connect into the back of the building where we have our services. All right, let's jump to our next slide. We'll take some images around the building. This is a view from the south, where we can see the front entrance, and then there's a glass atrium type space that will look a little bit more as we come in. And just as we'll look at the plans, and we'll go through them floor by floor, but just as you're looking at it, on our upper 2 floors, we have 2 wings of inpatient that have views out to the landscape and across the century here. And then off to the right here, we have a single-story area where some of the clinic spaces is, like dialysis and cancer care are off to that side. And then off to the back side of the building is the emergency that we'll see in a moment. We can jump to the next one. So this is a picture from, I believe, about a week ago, looking from a similar direction to that last image. So we have the main entrance coming in here. We have our clinic wing here, emergency departments over on the back side here, and then we have those 2 wings of inpatient rooms that are on the upper 2 floors. You'll see over here we have the white cladding on this side. That will eventually work its way around and come right up to the front here. So that similar sort of finish here. It won't be, this is just the insulation we're seeing that's in behind there. And then we have each of the stair towers is clad in masonry. And so that's what all this scaffolding is around the front here is, as they do the masonry up the front of the building here. You can also see out to the back, we have the helipad. Some of the assessments that we did in that was due to the predominant wind directions for both the helicopters landing and taking off, as well as the fumes not getting induced into the building system. Having it off to that northeast side helped for that for both of our predominant wind directions as we have that. And then off to the north, we have the office site is the golf course and the river and the lagoons across the river there. All right, let's jump to the next one. So this is looking from the south side. There are some landscaped forms that we have both on the south side and then around the north. Some of that will have planting on it, and also for both interest and for snow to retain some of that. The nice thing of this photo, we took it first thing in the morning, and you can see that there's nice fog down the valley to the north here. The next photo we're going to look at is, oops, sorry, you can just go back for 1 second. Just on the west side of one of the wings here, we have an exterior patio space that will be able to be accessed. When we look at the inside, just in this area here is the cafe that's open to the public, and then just adjacent to that is the staff lounge where people have lunches and that. And so that can flow out into a landscaped area that's just on the south side here with nice shelter from the building and be planted up. So we can jump to that slide. So this is the slide here. The trees will take a little while to get quite this big, but as we come into here, it is divided loosely into a staff side because they'll come out of their entry here, and then a public side with a bit of a divider wall, but reasonably it's all open and people can flow and mill around through this area. So we have some benching, some seating, and then landscape to work with that and to have the building sheltering it from some of the winds and that as the trees grow up in that too. All right, let's take a look at the next one. So this is the same one looking from just as you're coming out of the cafe and looking out there towards the south. All right, let's jump to the next. So this is on the north side of the site where we have the emergency department. And so much of the concrete for here is already in, but it'll get developed further. And as we look at the floor plan, there's a connecting area from the front entrance over to the emergency department because sometimes there is you need access between those. And then the diagnostic imaging will be accessed just off the side of that corridor. Next slide. So this is looking at that, the current status of construction on that side. And so we've got most of the single-story portion is in, and then actually the back side of the building was the first area to get most of its cladding. And then you can see over here we have the ambulance garage, and then the walkway that heads out towards the helipad. And then in the back here we can see the generator building, which will eventually have a tall exhaust stack on the back to get the fumes from that up and above the building. So that will be going in shortly. Great. So our next slide will. We have one more of the outside. This is just of the back of the building where the trucks come in, and just to the right of us is that generator building. So probably not too much interest from that one, but it's lit in there. All right, so next we'll go and we'll take a look. Oh, got numbers, sorry, I thought we were at the other side. So we'll go through each of the floors and talk about these spaces, but just as an overview of what's in the building, we have 60 private bedrooms. All the bedrooms are private, no shared spaces, both for infection control, and that's current standards of how we build healthcare facilities. Those are a combination of medical beds, surgical beds, and then we have some specialty beds. So bariatric is for higher rate patients that has larger spaces, larger doors to accommodate people. We have some airborne isolation rooms for folks that have airborne infectious disease. And then we also have palliative care rooms that are able to support people in their end of life. We have an obstetrics department, which has 3 labor, delivery, recovery, postpartum rooms, so you stay in the same room the whole time, you don't get moved around. And then one of them has a water birthing tub in there to support that type of delivery. In the emergency department, we'll go through there. It has 14 treatment bays that range in acuity from trauma bays, regular care, and then some of the brief treatment bays that are for higher throughput, so you're able to serve people of all the acuity levels that come in the door. In the outpatient, we have 10 exam treatment bays. In cancer care, there are 6, and in renal dialysis, we have 9 treatment stations. And then up on the second floor, we have 2 operating rooms and 2 procedure rooms, so we'll take a look at that as we go through the floor plates. On our next slide, we have some of the just interesting stats. I won't go through all of these, but just to cover a few of them, the site is 39 acres. The floor area of the building is 180,000 over the 3 floors. We talked a bit about the fully electric building and some of the advantages of that. With the foundation, the building is held up on 822 piles that go deep down into the building, so that or into the ground, so that we don't move. We have 4,000 cubic meters of concrete, and the one that's kind of fun is the 400 kilometers of electrical wire is going into the building. There's a lot of electricity in a health center this size.
So as you can see, since we last met, there's been a phenomenal amount of progress. We have been continuing to meet. So just not the clinical folks, I would say every group of staff that's going to be working in this new building. So right from nutrition services to the folks that are going to be supplying the stock, to the clinical staff, to the building maintenance folks. What we know right now to date, based on schedule, is that we're anticipating PMH will receive the building in the summer of 2026. And then there's a lot of things that need to happen once we get the building before we can actually have a first patient into the building. And that will be either late 2026 or early 2027. The clinical staff and the physicians have been very involved and engaged throughout this whole process and continue to be. As Matt showed you, we've had more mock-ups in the actual current hospital, the new one, in February and in June. And that was really fine-tuning the last parts of the design. So things like, did we have the electrical outlets in the right spots? Were they the right height for ergonomics? So we've had lots and lots of engagement, and so the design is pretty much complete. We have also finished the staffing model, and that is the full staffing model for the entire hospital. So just not clinical staff, but also the facility engineering staff, the nutrition staff, the cleaning staff. All of that model has been complete. And the equipment list, that is complete, but we're just doing some final reviews on it. Naturally, when we get into procurement of the equipment, things like accessories that we need to purchase, we'll be talking lots about that. So there's a lot of work that's taking place to be ready for when the keys are handed over and in preparation for when we can actually have our first patient day in. So our next steps, we've been having operational readiness meetings, and those will continue. So we've had one round with all of the staff to talk about how are they going to work in the new building, what is some of the new equipment that they're going to have, what are the training needs that are going to be required before staff can actually physically work in the building, so orientating them to those things. And then we'll start to develop the move plan. So there are two different things. But we're very much working on the operational plan right now, and we'll continue to do that. And then we'll shift into the move plan, and what will that look like? We have a staffing plan, so we've been working with HR in terms of how we plan to onboard staff. We have developed a plan and are hoping to actually start onboarding some staff within 2025. We are developing an orientation and a training plan. So as I said, there's lots of orientation, lots of training with new equipment, new devices, new systems that are going to be in the hospital that we need to train staff before we can actually have it open to the patients. We anticipate that whole training plan and orientation will take anywhere from 3 to 6 months once we get the hospital handed over to us until we can see our first patient. So part of the work we're doing right now is developing that plan and working it back so we can understand, is it 3 months, is it 4 months, is it 5, how many months is it going to take us? We're also going to have a phased opening, so concerns that I'm sure that you have is how are we going to staff that building? We have the same concerns. So we have a staffing plan that kind of goes plan A, plan B, but plan A is where we will move all the services that are currently provided in your hospital to the new hospital before we take on additional services. So when Matt talked about the 60 beds, in that phased opening, we will not open all 60 beds at the start. We'll open 30 beds. The ambulatory care area, where there was the outpatient treatment for people that come in for frequent dressing changes for IV therapy, we will not open that on the first day. The renal unit, that will probably not open on the first day. So again, it's taking the services that are currently provided in the current Neepawa hospital, moving those services over to the new hospital, and then as staff get comfortable, and we'll reevaluate the HR plan, and so how many staff we have hired, then we will gradually open all those other services. It is important that we have an HHR plan, but equally important, the staff have to feel real comfortable in working in that new hospital and feel comfortable with the new services, but as not only the nurse services, but all the new equipment that they're going to be working with. So it's very important that we do really good training, really good orientation, get them comfortable in working in that new environment before we add on additional services. So there is going to be a phased opening.
Good evening, ladies and gentlemen. Welcome to Titans hockey here on NAC TV. Knox digs it out. Knox behind his own net. Now right side, Alexander. Alexander, big long pass, trying to get onto a Paquette. As a good job by Olszanowski to get way out and cut that off. McDonald gets it up to the red line. He'll dump it in deep. Olszanowski plays it behind his net, but it's Neepawa picking it up. Back towards the point. Lagria shot. On net. That's deflected to the sideboards by Olszanowski. Steelers can't clear. Neepawa, high slot area shot. Rebound, and Olszanowski knocks it down, and he's going to hang on. Off the drop, puck taken out of harm's way by Petricus. Around the boards, Steelers bring it into the Neepawa zone with control. Forced wide. Centering pass! Oh, what a save by Cookett on the good one-timer by Guevara. Brought in on the delayed offside. Steelers, time to get organized. Their right side. Shot. Karam's off of a player. Comes in. Now there's opportunity. And again, Casey Cookett shuts the door. Woo! 25 seconds remaining in Selkirk's man advantage. Oh, I should say that. In this period. Steelers now from their own zone. Carrying it forward. Ziegler plays it into the Neepawa end. McDonald rims it around the boards, and that'll hop on pass with him. Neepawa in. 2-on-0. 2-on-0 shot. They score! Haggerty short-handed on the turnover with 5.6 seconds.
And that's why you play to the whistle.
Yeah. Hartley quickly in. Behind the net, Hartley looking for some help. Hartley puts on the brakes. Hartley turns back again. Twisting, turning. Hartley working out front. Loose puck. Neepawa can't find it. It's still loose, and out goes Olszanowski as Johnston and Lagria say hello. Played down along the end boards. Haggerty tying it up. Warnock, he's helped out by McCann. Out front. Oh, backhand! What a save by Olszanowski. The little spinorama backhand by Carter McLeod.
And he just had his glove right there and was like, nope, that's mine.
Guevara leaves it. Now he'll get it back. Top of the face-off circle. Guevara just sort of roams along the blue line. His cross-ice pass. Kept in the zone, but now chipped up ice, and Neepawa with a possible breakaway. Yes, in, off the stick of Maloney. Dylan McCann plays it into the corner, but it's the Steelers there first. Drop pass to the side of the face-off circle. Turning with it. Ponce can't control, but now the Steelers will. Branson towards the front of the net. Cook. Oh, and Cook had stayed with him. Quickly on the forecheck. Babic. He's bumped hard along the end boards. Takonic there to find it. Up. And Paquette relays it up and out. Alexander gets a free gift. Shot. Oh, what a save again by Olszanowski. Dumped deep into the Neepawa end. Knox back to get a hold of it. Puts on the brakes. Knox. Good forecheck. Branson, side of the face, out front. Oh, that's tipped out of harm's way. Back to the point, though. Ziegler rims it along the end boards. Branson bumped hard. Chipped into the corner. Knox. Oh, Knox goes down, turns it over. Guevara trying to come out front. Guevara, shot, he scores! On a great individual effort out of the corner. And Rowan Guevara controls. I can see why he's for sure in the top 20, maybe top 10, I'm not sure. Puck along the end board. Steelers, Jamieson. Cycles it to McCarthy. McCarthy forced back towards the blue line. He'll turn it over. Haggerty. Haggerty gets loose. Haggerty in. He's penalty coming up as he's tied up. Slot area shot and saved by Olszanowski. Haggerty in to take this draw against Jamieson. On the draw. Play back towards the point. It comes out and McLeod up. McLeod in all alone. McLeod shoots. Save Olszanowski. into the corner, and that'll take care of the period. We're going to overtime. Witham, one-on-one. Witham, shot on net, knocked down. We are going to a shootout. Looks like it's going to be Wyatt Witham starting for the Selkirk Steelers. Cook it out to meet him. Witham in. Witham looking to shoot. Whoa! Finds the inside of the post, and Witham gets the Steelers first on the scoreboard. Next it'll be Colton Alexander for the Titans. Olszanowski getting out to meet him. Alexander, shoot! Oh, and a save by Olszanowski. I thought Alexander had beat him with that little deke, but Olszanowski got the pad out.
He did.
Guevara for Selkirk. Big opportunity for the Steelers. Shot! Cook it, the save! Logan Paquette next for the Titans. Dipsy Doodling comes in. Shot! Scores! Third shooter for the Steelers. Sharp angle. Oh, and again, Cookett comes up large against Owen Warnick. So, Tim Taconic, can he do it? Picks up the puck, winds his way in. Taconic. He scores! Tim Taconic! So, the Titans in the shootout